Welcome to Firstnet training. Today we'll be covering the EHR documentation for Firstnet for ER providers. When you arrive to the facility and log into the desktop, you're going to look for an icon called Cerner Hub 6. Once you've located the icon, you'll double click on the icon and this window is going to appear. It will ask you to enter your credentials. Your username and password will be your tenant username and password. Once you log in, you're going to have all these applications show up in your Citrix workspace right here. The icon that you're looking for is going to be called Firstnet Dragon. This will load the Dragon application for you so that you could use it for your dictations in here. If you choose not to use Dragon, then you do have the Firstnet application without the Dragon application attached to it. Most of the recommended workflow for the ER providers is to use the Firstnet Dragon application right here. You will double click and ER Firstnet was going to open up for you. Now, since this is your first time logging in, you will get your location set up right here. This is important that we set it up at the very beginning, and you'll be able to change your locations at any time. This right here is showing MBH, which is the Northeast Baptist ER. All you have to do to switch to different locations is hit the little drop down right here, and it'll give you different locations in here. Once you set up your location, you're going to say OK. Once you select OK, then the main ER launch point is going to start loading up for you, and you'll be able to see the information for your patients in here. Now, before we even start discussing how to navigate the application, let's talk about a very important setup that you have to do on your first day. On your corner right here, you're going to look for this three little lines right here with a little drop down. And when you kind of hover over it, it gives you this drop down. Change location, check in. Changing locations will allow you to change your locations, especially if you're going from one facility to another. Checking in is what's going to allow you to set up your profile. When I select check in, your display name is going to show up right here. Your initials will display right here. And what you need to select is your provider role. ED physician, or if you are a mid-level provider, then it will be the ED mid-level provider section right here. I am going to choose ED physician. Now, the default relationship is very important that we select as well. Here we have ED physician. And then the last thing we need to double check and double select is what we call the associated provider color. You will check this little box right here. Here you can choose any color that you prefer. Once I select a color, my initials will be highlighted in that specific color. Once I have all my selections corrected over here, all you have to do is say OK. You only have to do this once. You don't have to go back into that section and check out. Most of the providers here at the Baptist facility just stay checked in for their visit. The only time they might click on checkout if they want to update maybe their initials or change their color. Now that I have successfully checked in, now I can start actually looking at my patients in here. The first thing that you're going to see is what we call the launch point. This is the board where you're going to see who's coming to the ED, whether they're still in the waiting room, if they're being checked out already. This is everything that you need. It's all going to be on your launch point. Right now, my MBH All Bed section is showing up blank because all the patients are currently in the waiting room for us in here. Now, before I start discussing and breaking down the launch point, let's talk about the service bar that we have right here. ED Launch Point pretty much takes you back to the launch point page, to your main beginnings page. The icons that are really used by providers is what is usually the ED Launch Point, the results callback work list. The results callback work list will have any patient who was departed from the ER that had results pending. Here, usually the charge nurse will navigate that work list for you, selecting which type of results they're looking for, whether they're COVID or lab callbacks. They'll select the facility that they're working on, for example, Northeast, and then the locations right here, Northeast Emergency Room. They'll select submit and they'll say update the list. In here, you'll have a list of all the patients who are departed from the ER with results pending. From there, the charge nurse will usually coordinate with the patient and with the provider on the ER that day to start calling back those patients to maybe if there's any results that need to be called out to the patients from here. So you'll find that information in the results callback work list. Another icon that's used by the providers is what we call the message center in here. Your message center is kind of like an inbox, very similar to an email. In here, you might have documents that are still pending your co-signing. In here, you might have some orders to approve. This could be orders that nursing staff might have entered for you as an emergency, as a verbal or telephone order, and they're here for you to approve. From time to time, you might get some messages in here as well. These messages can be from our medical records or our HIM, asking you to look at a specific record if you're missing any type of diagnosis. So it's pretty much a query messaging system in here. From the other icons that you have in here, the auto text copy utility is a very nice utility icon right here. This allows you to copy other users' templates in here for your notes. On the My Auto Text library, this is going to be your selection right here. This is what we have for you. Right now, there's nothing in here that I have saved, but I can start looking at other users in here. So when I am with a provider, I notice that they have a very nice template and I wanted to copy that template. All you have to do in here is type in their name. And it's going to start looking for those physicians for you. I am using Dr. Lim as an example. I select OK. And you see how it starts populating them for me. If you accidentally click close, it kind of cancels your applications in here. If this happens to you, just go back to the little search and then search for your provider. I'm going to use Dr. Toley as an example. And his name shows up right here. Double click and it displays all his templates that he has saved to his profile. You can review them by clicking on them and it gives you a little preview of whatever little templates he has selected in there. If you wanted to copy this to your profile, here's a little copy function. When you select copy, it allows you to actually change the abbreviation. So as you can see, Dr. Tolley uses a dash to pull in that template. You can always update it or you can leave it as it is in here. And all you have to do is say copy. You will get this logout screen notification here, so you can log out and those changes will push to your profile. At this point, I am not going to log out. I'm going to cancel. But basically what it's going to do, your little auto text utility has been copied to your profile from here. If you want to create your own auto text in here, then all you have to do is click on this three little paper right here. Here, all you have to do to create your own is hit the add, which is this little plus sign in blue. And it's pretty much a blank document in here. From here, you can start entering your information. You can select it in here, make little spaces. Pretty much is a Word document in here. You can also bring in phrases as well. If you want specific information from the chart to pull in, you can use the little section right here called Insert Template or Tokens. And then here, let's say as an example, you wanted to pull in the allergies for the patient. You can select that code and it'll add that information for you. You can also create drop-downs as well. So in here, we've used this little create drop-down list. This allows you to create drop-downs in here. You can differentiate from left to right. You can make different selections of drop-downs as well. Once you have the text that you want to use, then it's very important that we select an abbreviation for you. Mostly the standard here, most providers use a symbol. It could be a period, an equal sign, or it could be a number as well. As an example, I'm going to use a period and the word test, so that every time I type in period test, this information is going to populate for me. You can add a description as well, especially if you have multiple auto text, so you can kind of differentiate what each one is meant for as well. Once you have the information that you need, you can save this auto text and it's going to create it right here under your profile. You can still edit the auto text. You can make a copy of it. You can also delete it if you need to in here. Once you're done with this information, you can just hit the little X and then it's going to add that information in here. The next icon that we have over is what we call HPF Hub 6. Right here, this is the application that HIM/medical record uses for any of those old paper charts or any paper documentation that was done on the patient. They get automatically scanned in once the patient gets departed. In here, you'll be able to click and log in with your username, which is your tenant username, and in there you might find some of those deficiencies as well. If you ever have issues with HPF, basically medical records will be your point of contact for those issues in here. You have the exit, which allows you to exit the application. You have the depart, which can bring the discharge paperwork for the patient. And also you have the patient's pharmacy in here. This will allow you to document the pharmacy for the patient when sending prescriptions electronically in here. Now that I've covered the actual taskbar right here at the very top, let's go ahead and start with our launch point. Now, our launch point is pretty much designed like if it was a big Excel spreadsheet. First tabs that you're going to use the most are the My Patient tab, which basically what it does is once you assign yourself to a patient, it will automatically assign the patients to you. It'll filter them down for you. The All Beds will show all the beds in the ED. Currently, my beds are showing up that I don't have any patients. The Waiting Room will show the waiting room for you. The charge nurse or the triage nurse will be the one assigning the beds for the patient once their triage is complete. For the purpose of today's training, I am going to assign them a bed, but this is not the standard workflow a provider will be doing. The nurse will be doing this for you. Now, the rest of these tabs right here vary by location, but in reality, the tabs that the providers use the most are the My Patient tab, the All Beds, and the Waiting Room. Now, at the very, very end of your taskbar right here, you have what we call the Checkout tab. Under the Checkout tab, this is where you're going to find patients who were departed from the ER, whether they're being admitted, they got discharged home, or they got transferred to another facility. What's very nice about the Checkout tab is that you have your filters right here. You can go all the way to 72 hours from here, from 12 to 72. Now, if it's past the 72-hour mark, you can go to the custom and select your time range from right here. You can also switch it out to just search for your patients, the patients that you are assigned to. And you can also check on your note status right here. Maybe you were wondering if you completed your notes for a specific date. In here, you can also select right here, let's say a patient that my notes were just saved and I haven't signed them yet. Or maybe some of the notes that still need to be co-signed. I can apply those filters and it'll filter those patients down. And on this little corner right here where it says My Documents, you'll be able to tell the difference in there of which notes are still pending for you to co-sign. All you have to do to open those notes is double click on that little paper icon that's going to show up in here. Now let's go back into our ED launch point where the All Beds section is located. In here, you have your filters as well. If I wanted to filter it down to the patients that I'm assigned to, then I can select right here and it'll filter it down to the patients that I'm assigned to. I haven't assigned myself to any patient. That's why this filter is showing nothing for me. I can also see on patients who haven't been assigned yet, and as you can see, it creates that little filter right here, and you see how these two patients don't have a provider assigned to them at this point. Now you also have the empty beds filter right here. As you can see right now, it's showing patients who are bedded in the ER, and it's also showing empty beds. You can always hide those empty beds and just have the patients that are currently bedded in the ER here. You could use the waiting room right here, but most of the providers don't use the waiting room filter right here. They tend to just add the waiting room separately in here. But if you do choose to add the waiting room, you can always add the waiting room filter into the All Beds in here. It's a user's preference in here. Now on these two patients that we have in here, let's start breaking down the board for us. You have a room column, which pretty much tells you what room the patient's located. This next column right here, you have your physician notification column. As you can see, this patient has 8 notifications. This other patient has 1 notification in here. You also have the length of stay column, which pretty much gives you the breakdown of their length of stay for this patient. Next column over is the acuity level. Once the triage nurse documents that acuity level for that patient, you will see the numbers right here, and they'll be color coded as well. Next column over is what we call the patient's information column. It has the patient's information, their age, their name, their age, their gender, and also you're going to see little icons right here. There's about 20 plus icons. what you can do to start familiarizing yourself with the icons is just hover over the icon. It'll give you that information. As an example, it's been documented that this patient doesn't have any allergies. On this icon right here, it tells me that this patient has allergies to penicillin. Next column over is the assignment column in here. This is where you get to assign yourself to a patient. You have the physician column, a mid-level column, a resident, and of course the RN, so you can see which are the nurses assigned to your patients right here. To assign yourself to a patient, all you have to do is click on the column right here. The little assignment box is going to show up, and all you have to do is say assign. And it will display your initials that you set up during the check-in, and it will have that color that you chose in here. Now, the moment that you assign yourself to a patient, you're going to see that the documents column is going to start creating icons for you. In here, we have the no documents started icon show up. Pretty much is telling you that you haven't started your document from here. As you're working through your patient and start documenting through the workflow and saving your note, the icon is going to start changing for you. The next column over will tell you if there's any other documents. This could be documents from other ER providers, other physicians. You might be able to see them in here depending if there's any documents from a ER physician. Next column pretty much gives you the status column. In here, once you enter an admit order, a discharge order, the status is going to be changing in here. The next column over gives you the details. Right now, this patient already has a diagnosis, so the diagnosis is showing up in here. This column pretty much will have a 3-step process. When the patient shows up and they get registered, registration will document their reason for visit. Once the nurse actually documents during their triage their reason for visit as well, then it's going to update to the triage information in here. Once the provider enters a diagnosis, then you will see the DX show up right here. You also have a little comment box right here, which the staff uses to communicate with one another about the patient, information of where they're being admitted to, or maybe who's the hospitalist on call that day that's going to be admitting the patient for you in here. So you will see information on the comment boxes right here. Now the next section we have over are the icons right here. These icons give you a breakdown of medications, labs, EKGs, radiology, patient care items, and any consults if they have been ordered. As an example, I'm going to click on the medication, which gives you a little summary right here that there's 3 medications ordered. You can select it and it will open up this window. It will give you the status of those orders, and if you choose to, you can always add a new order from here. What we have in here are we call order favorites right here. These are generic ones in here that the system has here for quick pick for you. If you needed to order something from these, all you have to do is select it and hit sign and it'll order that medication for you. You see how the little number turned green, kind of like if you're buying something in here, kind of has a little shopping cart for you. You can unselect it and it just turns it back in here. The little test tube right here will give you results. We have a flow sheet view and a quick view in here. You can also check on the status of your orders as well. So in here, it will give you the status if they're already been dispatched, they're already collected, they're already in lab, just pending results in here. You also have the same favorites right here where you can select and click on favorites. Next tab over is what we call the EKG tab right here. In here, you'll be able to enter an EKG order. And once you enter the order, staff will see that order, perform that EKG, and the status is going to change from ordered to complete. Once the status has been changed to complete, you'll be able to click on the hyperlink, and the image for the EKG will open up, and you'll be able to enter your interpretation. Right now, it's not giving me that option because this has not been completed yet. It's still in the order status for you. Radiology will have the same information. You have your favorites right here. You'll have your reports right here. Once the report is ready and available, then the icon right here will be hyperlinked for you where you can click and view the report as well. The little bag right here will have any patient care items in here. So any items that you might have ordered, they will show up in here. Consent forms, maybe you order a blood transfusion, nurses will see that from here. And you can also check on the status of those orders as well. You also have favorites in here. One of the favorites that the providers use the most is the laceration tray setup from here. The little phone will have your consults. So if you need to enter a consult order, you have them listed right here for you. The workflow for this is once you enter a consult order and document which provider or what service you're looking for, the unit clerk will see that information and then they will correlate that consult for you, and then they'll put that provider on the phone for you. The little heart right here will show your vital signs for the patient. The little summary shadow person right here will give you a patient summary right here. Once you're done looking at the icons, here is the close icon right here, and this will close the screen in here. Now from the actual tracking board right here, or what we call the launch point, you can also have your vital signs displayed. As you can see, mine are hidden right here, but I can click on the little heart with a little arrow and I can have them expanded and I can have them available to me, so I can always constantly be looking at the vital signs for the patient. You can hover over them and it'll tell you the time which these vital signs were taken, and if there's any additional information, it will show up in here for you. Now another neat function that we have in Firstnet is the right-clicking function. Right-clicking function will allow you to bring in this drop-down, and it will allow you to open charts to the specific areas that you want. It will also allow you to create some forms, enter the discharge order, or transfer orders from here. Now before I even start messing with these icons right here, let's talk about this section right here more carefully. So as an example, I have assigned myself to this patient right here, and the icon is right here for my MEC to be completed in here. This icon is very important that we select and we hit complete the moment that we laid eyes on our patients in here. All you have to do to complete is click on it and say complete. The icon will disappear, and what you're going to see eventually in a couple of seconds is a little key that's going to show up in here. You don't have to take action on the key whatsoever. This icon is going to show up so that registration knows that now they can go and see and fully grab the rest of the information for the patient for billing in here. Very important that we always make sure we are completing our MEC as soon as we laid eyes on our patient. You also have orders to cosign. So if the nurse or the nursing staff enters any orders for you, you can click on the review. You'll be able to see the orders that were entered, and you can quickly cosign them from here. And as you can see, the icons are going to start changing for you. Now that I've assigned myself to the patient, completed my MEC, I want to start my documentation. You can right click, and from these sections, these are the sections of the chart that are used mostly by providers. Let's talk about the provider view. When I click on provider view, it's going to open the patient's chart, and it's going to load what we call the provider view. It's also going to have 3 tabs: the ED workflow, the quick orders, and demographics page in here. The ED workflow, basically what it is a summary of the chart in what we call a workflow component. What's nice about these features is that you can grab these sections and arrange them into the areas or put them in a format that makes it easier for you to review the charts. The very first thing you're going to see the triage review from here. The reason for visit, their vital signs will be in here. Anything that was documented during triage, you'll be able to see it right here. You'll be also have the ability to check the PDMP report from right here. You'll be able to review the mechanism of injury that's been documented, their screening and history from nursing, vital signs in here. You can check the last 24 all the way to 3 months if need to. You also have the new order entry. The new order entry will allow you to start entering orders. From here, you have the inpatient, so you can start entering orders, or if you need to send a prescription, you can switch it to discharge, and you can start entering your discharge prescriptions from here. Now, there is a quicker way to enter orders, and that's when this little ED quick orders is going to come into play. When I click on the ED quick orders, this pretty much brings you a big catalog for you. Here it's separated by services in here. So we have medications, radiology, labs, CT, and ultrasounds in here. All you have to do to enter an order from these categories is select them. As I'm selecting them, it's putting the order here for me to sign. I can select other orders if I need to. And yes, you can see the little number starts adding up here. Medications work the same way. If I have a medication that I want to administer, I have them in here, and I can select that medication in here. Once I'm ready to sign these orders, I can select it right here and hit sign. If I don't want to sign the orders, let's say I made an error and I don't need a CT, I can select it, and as you can see, it starts deselecting them for you. Now, if you go through these tabs right here and you notice that some of the orders that you're needing is not listed in here, then you can use the new order entry right here and search for the order where it says search for a new order. And it does the same thing. As you're typing, it starts helping you out to find the order. If this is the order that you need, then you can select it, and it does the same little process right here. You also have order sets in here. You have the public order sets, which have ED specific order sets right here for you. And you also have the shared order sets in here. The shared order sets allows you to look at order sets from other providers or from the Baptist facility. So the Baptist market created order sets specifically for the ER, and all that you have to do to access those is click on shared, go right here and type in Baptist Health System, BHS. And here it's going to give you different categories. And then from here you have the Baptist Health System Emergency Medicine folder. You'll select it, and it's going to give you 3 options right here. All you have to do to get to those order sets is select My Plan Favorites. In here, you have a list of order sets that were created for your group right here. You have abdominal pain, CT, COVID vaccine order sets, hip fractures. You have sepsis bundles in here. So you have pretty much anything that you need from right here. Some of the order sets that are very important that we use for our patients are, of course, the sepsis ones right here and the stroke ones in here. All you have to do to order them is select order. It goes up here. Let's say I wanted the sepsis and I wanted the stroke one right here. I can select both of them, and you can see the little number shows up right here. I can click on the number, and I can click modify the details so I can actually see the order sets in here. Now in here, the order set is going to show up for you right here. This is the sepsis antibiotic order set in here, and all you have to do is check the little boxes of what medications you want. If you look at the stroke order set right here, it gives you the same information as well, and all you have to do is check the little box. If you wanted to save these order sets as a favorite so you're not constantly searching for them, then you have the save as my favorite function right here. To sign these orders, the icon is right here to sign. So this covers the quick orders. Now let's go back to the workflow in here. Now from the new order entry, once you save those orders to your profile, then you can go to mine, and then your orders will be listed right here. You can also access the Baptist favorites from the share function using this selection right here and do the same thing. Baptist Health System, Emergency Medicine, and it'll give you the order sets right here. You can also search from orders from here, and you can select the orders that you're looking for as well. To do a prescription, it's the same functionality. You switch to discharge, and then you can look for a prescription right here. So if this is the medication that you want, you select it. It puts it up here. Same concept. You click on the little number, and you hit the modify details. It opens up the selection for you, and here's the Tylenol right here. Here you'll enter your information, the frequency, the dispense, and also the stop time if it's required. Anytime you have yellow boxes on your medications, it's something that needs to be required to be filled out. You can select the sending to. If the patient's pharmacy has been documented, you'll be able to send a prescription electronically, or you can print that prescription here. If this prescription is a controlled substance, then you will be set up for what we call the Imprivata application. And in there, the moment you hit sign and submit, it's going to open up the window so that you can authenticate that medication using the Imprivata application in here. Now the next section we're going to start looking at is what we call the workflow documentation in here. As you can see, as I'm going through these sections, the next section that you see is the subjective history of present illness. In here, on these boxes right here, you can start your documentation from these sections in here. If you have an auto text, you can use those little auto text in here. You can use drag and to dictate over, or you can simply just type over the information in here. Now the system does have generic templates in here or dot phrases that you can use. Two ways you can pull in those templates is by using the back bracket, which brings in ER specific templates for you. The backslash brings even more generic ones in here for you. As an example, if I wanted to pull in the physical exam template, I can double click and it pulls it in here for you. These sections you can still manipulate, delete. Now once you have the information that you want, you can say save. And it'll save that information for you. Review assistance, the same functionality. You can type in here. You can bring some of those templates. Let's say, for example, I wanted to bring an ED specific one. And it brings in that information for you. Same concept, you can still manipulate any of these. Now, if it has this little drop down arrow, you can click on it and you can change the information if you need to. Or you can completely take everything off in here. You always want to make sure you're saving your documentation so that when you start generating the document, everything will pull in at the end for you. Review of systems is here. Physical exam goes in here as well. You can use a backslash and you can pull in PE and it'll bring a very basic physical exam for you. Now again, if you created your own templates, then you can use those special characters that you created to pull in those templates in here. Since this is my first time using this template, all you have to do is say acknowledge and it'll pull in that information for you. You also have power forms right here. So if you need to document a power form, you have them listed in here. For example, if I wanted to document the heart score for the patient, you can click on the heart score and you can enter that information from here. The little check mark is going to be your sign function from here. The little cancel is this icon right here. Diagnosis and problems, you will be entering your diagnosis using this tab right here. And as you can notice, it has a little asterisk meaning that this is a requirement for all your patients in here. All you have to do to enter a diagnosis is click right here where it says add problem and type your diagnosis. So I want to enter it as an example. And it enters that information in here. Now, if you see this little icon right here, that means we need to also document a little bit more information about it, to be a little bit more specific about it. So all you have to do is click on that icon, and then in here you'll be able to enter your information from here, whether it's an ankle, right, left, all that information that you need from right here. You can also prioritize your diagnosis in here. Since I only enter one, it's automatically assigning a 1 to them. And as you can see that the moment I enter that diagnosis, the little check mark appears, meaning that we already met the requirement for our patients. We can review the patient's home medications. If they've been documented by nursing, you'll see that this patient has this medication as a home med. You can review their current medications that are being administered in the ED. You can review their allergies, their histories, procedural, family, and social, if they have already been documented by nursing. You can review documents for your patient. This patient unfortunately doesn't have any documents, but you can also change the filters as well. And these can be documents from any previous visits in here, whether we're in the ED or inpatient documents in here. You can review the patient's immunization record, their labs, microbiology reports, pathology reports, radiology reports. Here's that same x-ray that we're looking at earlier. You can select it as well. It'll open the report for you. And if the image is ready and attached to be viewed, you'll see this little icon that says View Image. You have the visits information, the orders profile. You can always check on the status of your orders. Intake and output for your patient, if there's any type of tubes and drains. Quality measures. Then you start getting into your documentation piece again. Here you can enter your medical decision making. If there were any procedures that were done, you can enter that information in here. You can also use our templates right here. EKG information can go in here. Outstanding orders. Scale and assessments. If you perform any re-examination or re-evaluation, this will go in here. And again, it's also a free text box as well. Your impression implant, it will pull in the diagnosis if it has been entered, and you can enter more information about your impression implant about that diagnosis. Consult, you'll have your consult information in here. So here again, it's another one of those free texts. You can use your template, you can use Dragon to enter your consult information in here. Then you have your disposition box in here as well. Patient education will allow you to enter the patient's education. So if there's any education or discharge instructions you want to attach to the patient, you will find them in here. Now, one of the things that you're going to see that it's automatically giving you suggestions based on the first diagnosis that we entered. And yes, you can see we have a couple of them in here. All you have to do to add that instruction is select it, and it's going to add it right here. If you wanted to modify it or view the document, then you can select modify in here. If the suggestions is not what you're looking for, then you can do more options and then search for the education in here. Or if you're looking for medication leaflets education, you can add it in here as well. Follow-up. Here you'll be able to enter a follow-up information. You do have some quick favorites right here. Or you can search for a provider in here. Here it'll give you a preview of that information. You can update the information. You can update the time frame. And once you're satisfied with what you need, you can say save. And it's going to add that to the patient's record in here. Now, from this point, if you wanted to pull in the discharge paperwork and start printing it out for your patient, then you have that option to do so by clicking on this little door right here called the discharge process. You can select it from here, review the information from the patient, which is this document right here. This will pull in the follow-up information that we added. If there were any type of orders or medication prescriptions that we added, they'll be listed in here, that education information. And then here's your sign and print in here. It'll print out the paperwork. You can give this to the nurse, and then the nurse will start their depart process for the patient. You can also access the same discharge process through the launch point, but it's also here available for you for convenience as well. Now that I've created all the information that I wanted, then I can actually create my note. I have the ED note, or I have an ED supervision / handoff note from here. Today I'm going to create an ED note. Once I select the ED note, all the information that I've documented on the workflow component will pull into my note. Here, it will pull in the information from the MEC. This is the time that I've documented that I saw the patient. You can always add more to it or add more information if you need to. You can adjust it if you need to. Chief complaint will pull in from the nurse's note. The present illness that I've documented is here, and you can still manipulate the information, add more information if needed. You can use your templates from the brackets. You can use the backslash, and here you can use Dragon to get to them. Review assistant pulls in for you. Physical exam, and as you can see on some of these, it pulls in automatically some vital signs for you. Allergies show up. Procedure information that we entered. Our medical decision. If I didn't enter anything at that point, I can always add that information from here now. Our consult, our disposition, patient education that we added, and of course the follow-up that we also added. On this other side right here, it automatically pulls in information from the patient's chart. As you can see, I don't have much information on this test patient, but the concept still applies in the live domain. Now, let's say in the process of you creating your note in here, a new lab result came in here, and you notice that it's not pulling into your note. That's where you're going to use this little refresh icon right here, and it'll refresh that display and it'll pull in that new lab result that came in while you were documenting on your note. Once I'm ready to sign and submit, here's my icon to sign and submit. If I'm not ready to sign and submit, maybe I'm waiting on lab results so I can finish my disposition, then I can save it and close it. Once I save it and close it, it's just going to take you back to the provider view. If you look at what we call the launch point component right here, you're going to see that the icon went from a white paper to in progress, meaning we were starting our note in what we call the workflow. And now that I've actually generated the document and save it, you're going to see that the icon went to a in progress note. I can access my note through here by selecting it, and it opens the note for you. I can go in and add that information that I needed, or I can refresh some of these components now that I have results for radiology. Once I have everything that I need, I can sign and submit, and I can select sign. Now, if you have a resident with you, this is where they will be able to enter that co-signature in there. Once I sign and submit, it closes this document for me and it takes me back. And you're going to see that the icon is still white. You can just refresh right here. And now it has the note as signed in here. Here's my note as being signed in here. If I wanted to review this note, you can click on review again, and it will open that note again for you. You'll be able to correct it and add an addendum if you need to at any points in here. Now, when I right click on my patient, let's talk about these components right here. Quick orders, which we already discussed, you can click on it and it automatically takes you to the quick orders page in here. I can go back to my launch point, I can right click, I can look at other documents from other providers, I can look at the patient's met list, or I can review the results in more detail if I'm not satisfied with the view that I have in here. These sections right here show the same power forms that we're looking at when we were talking about them in the workflow component. From here, you can also enter your decision to discharge, admit, or transfer in here. So you have the ability to enter your orders from here. You can request events in here if you need to for your charts. Or you can go all the way to the end and you can bring in the discharge process for your patient from here. This is the same thing as going into the chart, clicking the provider view, and using the little door right here to pull in the paperwork in here. Now, since I'm already here in the chart, let's discuss some of these components right here. These components are the same thing that are listed on the ED workflow. As you can see, orders are pretty much listed in here, orders profile. Now, what the providers do once they get acclimated to the workflow, these sections, they drag and drop them and set them up in the way that they want to start their documentation and kind of see their patients throughout. So you can always customize these sections in any way in any preference that you want. If there are specific sections that you don't utilize and you want to kind of save a little bit of your real space, then you can go to this little corner right here, components, and then you can uncheck some of those components. Let's say, for example, I never use the calculator component. I can uncheck it, and then that section refreshes, and as you can see, I don't have that information anymore displayed. So the recommendation is usually once you start acclimating to yourself to the ED workflow, you can start making your adjustments in here. Same concept for your quick orders. You have them all listed in here. You can go through these little lines right here, and you can color code your components in here. You can also go up here and change a little bit of the layout in here. I can select the different drag and dropping fixtures in here. You can unselect some of the components that you don't use, or you can add a folder for your favorites into the workflow component in here. The demographics page pretty much gives you demographics information. Orders profile in here pretty much gives you the order information from here. Procedural sedation will be in here. Results review will be in here. But in reality, most of the ER providers tend to just use what we call the ED workflow. This has all the information that they need from here and don't necessarily go through these components anymore in here. All the info that you need will be in here. Going back to the launch point in here, once the patient gets departed by the nurse through the discharge process, then you will find that patient on your checkout tab in here. And as I was discussing earlier, you can check on the status of your notes from right here. Once I select the My Patient, and let's say it was 12 hours ago, I can be able to see that information for your patient in here. And this concludes your Firstnet training.